We all know that the cost of prescription medications is rapidly increasing. In fact, most people are going to spend more money on prescriptions than anything else in healthcare. Medicare alone spends $120 billion on prescription medications. And that's why people have to have Part D plans. In fact, 1 in 4 people still find it difficult to pay for their prescription medications. And that's why Medicare is making some serious changes to Part D plans. I'm going to explain those changes in this video. Now, in order to understand drug plans for this year, 2023, and for the changes that are forthcoming in 2024, we have to first have a really good understanding of how drug plans are structured, because Medicare drug plans are structured differently than what you and I would have at a group plan at work or an individual plan. All right, so we're going to look at some of the details of the structure of drug plans, then we'll get into the changes. So number one, you have to realize that there are 4 different prescription payers, meaning that as you get prescriptions filled, it is rare that you're going to be the only payer. There's going to be someone else that's participating. So as we look at the overall cost of medications, it's not just out of your pocket. We have 4 payers. So the first one, of course, would be you. Once you enroll in Medicare and you have a prescription drug plan, you certainly are going to be out of pocket. That out of pocket could be copays, it could be coinsurance. So you will do some of the payments. Secondly, what we have is a Part D insurance plan. Now, when we start Medicare, there's one of 2 ways in which we use our Medicare benefits. And so we can enroll in Medicare A and B. Medicare pays first. Medicare doesn't pay for anything 100%. So what people do in A and B is they get some type of a supplemental plan. Most people there are getting a G plan or an N plan, but we have a supplemental plan. And then in this scenario, we actually add a prescription drug plan, and we call these standalone drug plans, standalone. And that just simply means that it is separate from our Medicare supplemental plan. So the meds that we self-administer, we have a standalone prescription drug plan. In most zip codes, there's anywhere from 15 to 25 standalone options for us to choose from. So we pick a plan based upon the meds we take in the pharmacy we want to go to. When we have a standalone plan, we chose it, but also we have a premium that we have to pay for that plan. And that varies. I think on the low side right now, there's plans that are in the range of $5 to $7 a month. I think the average right now is between $25 to $30 a month for a prescription drug plan that's standalone. Now, keep in mind, that's one way in which we can get a Part D plan. The second way is when someone enrolls into a Medicare Advantage plan. They have a Medicare Advantage plan. We give that the abbreviation's MA. And then when we have a Medicare Advantage plan for a prescription drug plan, we don't have standalone. One that we picked is actually one the Medicare Advantage company picks and includes it, embeds it. So we call those MAPD, Medicare Advantage with prescription drug plan. Now, keep in mind here, the company picked it. And that's why whenever you get a Medicare Advantage plan, you have to make sure that you have good medication coverage, because some of those embedded plans are very good and some are kind of mediocre. So you have to be careful. And so if I have a standalone plan, I picked it, and I can change that on an annual basis. Over here, the Medicare Advantage plan picked it for me. All right. But either way, these are credible Part D plans, and they will become a payer for some of the cost of your medications. Now, the third payer would be actually the drug manufacturer, whoever made that drug. Sometimes they're required to actually discount their medications. In other words, they have to sell those at a reduced price to you. And so that discount then allows you to get a lower cost, and therefore they also are a payer. And then lastly, of course, Medicare. Now, Medicare actually this year has $120 billion budget for medications alone, just for this year. All right, so Medicare is also a big payer. And so the whole point is this: as we look at the changes, you're going to notice as I show you these graphs, you have 4 different payers. And so we'll look at what the contribution of those payers will be for the cost of your medications. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. Now that we understand the payers, the 4 different ones, let's also now talk about the different phases of Part D plans, because again, this is something that's totally different. It's something that will be new to you once you go on Medicare, because our group plans and our individual plans don't don't have 4 faces. They actually just have 1 face, but all Medicare plans have 4 faces. So just a quick comparison. On your group plan at work, or your spouse's group plan at work, or your individual plan that you bought maybe through the healthcare exchange, you actually have 1 stage. And what that means is when a insurance plan covers a medication, what they normally do is just simply give you a copay. And that copay is your fixed out-of-pocket cost for the whole year. You could have a tier 1 medication, a $5 copay, and a tier 3 at a $25 copay. And whether you get that prescription filled in January or July or December, depending upon the tier, that determines your fixed copay for the whole year. So if I get a tier 1 medication in January, July, or December, it costs me $5 all year long. Tier 3, $25 copay all year long. Okay, that's a 1-stage plan. Fixed copays. When we go on a Medicare plan, either standalone or embedded, we're not going to have 1 stage. We're actually going to have 4 different phases. And this is why Medicare drug plans, frankly, are a little bit confusing, but it's also why we can have 1 medication that actually fluctuates. It actually can change copayments 4 times in the same year. Same medication, same everything, change the copays because of the phases. So let me explain the 4 phases, or what some call the 4 stages of every Part D plan. Number 1 is the deductible stage. Now, the deductible is set by Medicare. That is this year $505. In 2024, it's going to $540. In 2025, it's going to $545. But there's a deductible. Now, sometimes the plan actually will waive the deductible. Most of them don't, but that just simply means that you have out-of-pocket costs for your medications, and those out-of-pocket costs are going to go to the deductible. Frankly, a lot of people never meet the deductible, which means they will stay in stage 1 all year long. But if I'm on a lot of meds or expensive meds, then I'm going to meet my deductible 5 out of 5 out of pocket. And once I do, that takes me to stage 2. So we move to stage 2 if we meet our deductible, and when we meet it. If we don't, we stay in stage 1. But now we're in stage 2 because we met the deductible, or we're on a plan that waived it. And in the initial coverage stage, all we're doing here is paying very reasonable copays. Very reasonable. And normally the max is 25% of the retail cost of medication. Many times it's less than that, but the most it would ever be would be 25% of the actual retail cost. So we have very reasonable copays in this stage. But here's where things are different than your group plans or individual plans. Why we're in this stage, what's happening is behind the scenes, every time you get a prescription picked up, Medicare is tracking the retail cost. They track retail. Now, you're not paying retail. Now, you would have up here in this phase, but once we get here, you're not paying retail. You're just simply paying a very reasonable copay. But they track the retail cost. Let me just give you a quick example. Let's say you're taking a medication that retails for $600 a month. And the illustration I want to use would be Eliquis. Eliquis is a patented blood thinner. People take it especially when they have AFib. Most people that take Eliquis take 5 milligram tablets 2 a day. That prescription with 60 pills in a bottle retails for $600 on a monthly basis. And so if they're on that Eliquis, I can assure you they're going to meet the deductible, the very first fill that they have. Okay, so they're going to have this $505. But because we met our deductible now and we had to pay the $505, now we're in this second phase, so this would put us in the month of February, the second month, and now what we're paying, we're going to pay a copay. Now, I've got a lot of experience with Eliquis, and right now with most plans, it's a $45 copay for Eliquis. And so what the point is this, in this stage, I pay just a very reasonable copay, but Medicare and the pharmacy is tracking this retail number, which is $600. So every month, this retail total of my meds is increasing and increasing and increasing. And so what happens in this stage, if this total retail ever reaches during the year what we call the threshold, this year it's $4,660, and the key to that is it's retail. You didn't pay $46.60. In fact, you probably spent maybe $1,000, maybe $1,200 out of your pocket, but Medicare has been tracking the retail cost of that medication. And so if it's just $600 a month retail, how long will it take me to get to the $46.60? Well, just a little shy of 8 months. So from January to August, I have paid my deductible, I paid my $45 a month copay, but Medicare's tracking the retail cost. So within 8 months, I've reached that retail threshold. And when I do, if I do, that pushes me into what is called the next stage, which is the coverage gap, which we kind of in layman's terms, we call this the donut hole. Now remember what we said. We have 4 different payers. You pay some, Part D plan pays some, drug manufacturer sometimes discounts, and Medicare pays some of the costs. So up here, this is all your cost. But down here, what happened? You just had a copay. At most 25%, usually less. In my example of Eliquis, $45. Well, who paid the difference up to $600? It was that Part D plan. They had to pay the difference. So they actually spent $555. But what is Medicare doing? Medicare in this stage doesn't pay anything. They just simply track retail. But once we get to the threshold, and by the way, only about 10% of all people ever reach the donut hole. 90% will stay up here, but 10% reach the coverage gap. And now when we're here, we have a flat copay of 25% for sure. Here I said that would be the max. This actually is going to be the copay in the donut hole, in the coverage gap. And so in my example, if I'm on Eliquis, what's 25% of $600? My copay would absolutely be $150 a month. So in January, $505. February all the way through August, $45. Now I'm in the donut hole, and that medication cost me $150. Now Medicare in this area, this phase, is actually tracking a different number, and this is called the true out-of-pocket. True out-of-pocket. And it's $7,400 this year. It'll go up next year, but $7,400. Now what this is actually your out-of-pocket costs plus, watch, 70% manufacturer discount. Remember I told you they're a payer. So they have to discount that $600 medication 70%. So that $420 discount is actually credited or valued to you as though you paid it. So when we look at $7,400, that is not all your money. Yes, some of it is, your deductible, your copays are here for sure, but a lot of that $7,400 is the 70% discount that Medicare requires the manufacturer to give you. So again, this out of pocket for you probably was a couple $1,000s, and that was it. But once Medicare says if you ever hit that number, most don't, they say about 1% do. If I hit that number, that puts me in my 4th and final phase, which is called catastrophic. Now here, again, I have my 4th copay. So if I'm on Eliquis and I am in the catastrophic stage, my out-of-pocket cost is 5%. So that same medication now only costs me $30. So as you can see, depending upon the stage that I'm in, that will determine my copay. So I have to meet a deductible. I had a $45 copay through August, and then $150 in the donut hole. And if I end up being in the catastrophic, that same medication, same dosage, same frequency, same everything now only costs me $30. Okay, so that's why we have fluctuating copays in the whole Medicare Part D system, right? Just because Medicare is tracking these different numbers, and you're going to move through those phases based upon the actual retail cost of your meds. All right, now we have an understanding of the 4 different payers. Now we have the 4 different stages. So now let's look at the details now of 23, 24, and 25 as it relates to Part D plans. So right now, remember the 4 payers, you the enrollee, the Part D plan pays some, manufacturer discount, and Medicare. So we start over here with that stage 1. Remember the deductible stage. In this stage, you're responsible for 100% of the cost of medications up to the deductible. And remember what I said, this year it's $505. Once we have met that deductible, if we do, and again, some people never do, those who meet the deductible, then we'll go to stage 2, which is the initial coverage stage. Now notice, you as your payer, your out-of-pocket expense is 25% max. Remember what we said on that Eliquis, it was only $45. Okay, so usually the plans don't charge you the max, but that's the most you would ever pay out of pocket. Typically, it's a very reasonable copay. But remember what's happening in this stage? They're tracking the retail, and if we ever reach the threshold, $46.60, that puts us into the donut hole, the coverage gap, and here we pay a flat 25%. Remember that Eliquis? Now what? It cost me $150, so I pay 25% of the retail cost. And remember here they were tracking that other number. That was that $7,400 number called the true out-of-pocket, your out-of-pocket expense plus manufacturer discount. If I ever reach that, then I go over here to the catastrophic stage. And remember what I said? Your out-of-pocket is now 5%. The plan you're on, Part D plan, actually has to pay 15%, and all of this is on Medicare. They're going to pay the 80%. So this is the present structure. 4 payers, 4 stages, and you can see what you're going to be out of pocket. 100% until you met the deductible, 25, 25, and then 5%. All right, now let's look at what's changing from this structure into 2024. So here's what's going to happen. So here's your year 2024. Again, deductible. The deductible is going to be $540. So it went up a little bit for 2024. So they raised it, and that's it. So again, you're out of pocket 100% until you reach your deductible, and then that puts us into stage 2, and you'll see nothing is changing at all in stage 2. The most you would pay is 25% or just some kind of a reasonable copay, and then again that Part D plan pays the balance, and that's why you get a Part D plan, because you want them to pick up that expense. So what's happening here, they're tracking retail. And so remember I said $46.60. Now we don't know if they're going to raise that in 2024. They have not announced that, but if it goes up, it's going to go up a little bit. And so once we reach the retail, if we ever do, remember 1 out of 10 will do, that puts us into the coverage gap. All right? And so you're going to notice what's happening, no change into 2024. You're still going to be 25% out of pocket on your copayment. The 5% is going to be paid by the plan itself, and then you got the manufacturer discount 70%. Remember, that 70% discount is credited to you, and again, this number for the threshold, this year it's $7,400. It will be at $8,000, so it's going to go up about $600. And then you're responsible for 25% of that. So our meds are going to be a little bit more expensive in the coverage gap going into next year. Not huge, but it's going to go up some. And then when we get into catastrophic, notice here's where the change is for 2024. Look what happens. In this year, you have to pay 5% if you ever get into the catastrophic phase. And when you, in 2024, get to catastrophic and you no longer have any responsibility, so you are actually zero. Why? Because the plan this year pays 15, next year they got to pay 20%, and again, Medicare is going to pay their same amount. So our Part D plan is going to have an increased liability if someone gets to the catastrophic stage. And again, anyone that's taking cancer medication, those kind of things, definitely are going to get into the catastrophic stage. All right, so that's what's going to happen in 2024. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. All right, that brings us then to 2025, and really here's where the big changes are going to occur. Again, we have 4 potential payers, and we did have 4 stages. Now we're moving to 3 stages, because you'll notice the coverage gap, the donut hole, is going to be totally eliminated. It will no longer exist beginning in January 1, 2025. So let's look at your medications for 2025. First off, the deductible. Same thing applies. You're responsible for the 100% of the deductible. They say the deductible will be $545 in 2025. Remember, this year it's $505. 2024 is $540. All right, so we have total out of pocket by you because you're the only payer in the deductible stage. Once we've met the deductible, if we ever do, then we go to initial coverage. And so in this stage right now, what will happen, just like as before, your out of pocket expense is going to be 25% maximum copay. And remember, usually it's less, but that's the most they can ever charge you here. But notice what happened. In this stage, before, what was going on was in 23 and 24, the Part D plan paid 5%. Now they're going to have to pay 65%. And the manufacturer is going to have to do a 10% discount on the medications. They didn't have to do that in that other stage. So here's your Part D plan. So, right? So at this point in time, in the initial coverage, they were 75, so theirs is going to go down a little bit, and the manufacturer discount is going to apply as also an additional payer in this stage. And so what's happening here is this, folks. The max out-of-pocket in these 2 stages for you will be $2,000. Okay? They're not tracking a retail cost anymore at all. It is your out-of-pocket cost that's tracked. So if you meet your deductible, then you have your copays. Maximum of those will be 25%. But once we reach that $2,000 threshold, that puts us then into catastrophic. Notice, no more donut hole, no more coverage gap. We go straight to catastrophic, and notice you have no additional out-of-pocket expense because those meds, now watch, the Part D plan now has to pay 60%. Medicare will pay 20%, and then the drug manufacturer is going to have to give a 20% discount in this phases here. You see, before Medicare paid 80%, now Medicare is going to pay 20%. Manufacturer had no responsibility to discount drugs in catastrophic before, and now they got to give a 20%. Now that Part D plan, they only paid 20, and now they're going to pay 60%. And so this is really a huge blessing to those people that are on Medicare once we get to 2025, because once you've hit that $2,000 threshold, other than your premium that you have to pay for that Part D plan, you'll be no out-of-pocket expense whatsoever. So there's going to be a $2,000 cap beginning in 2025. So these are the changes that are coming in 24 and 25.